Hello and welcome to In Conversation. A new beginning has been made to go back to our roots, to preserve and use our traditional wisdom for holistic health and well-being of the whole world. The World Health Organization Global Center for Traditional Medicine in Jamnagar, India is a step in that direction. It is the first such center in the whole world. And today we are joined by two eminent personalities who are closely associated with this project. I'm pleased to introduce Dr. Shyama Kuruvilla, Senior Strategic Advisor with the WHO. Welcome, Dr. Shyama, to Doordarshan. And we also have with us Dr. Bhushan Patwardhan. He is Ayush Lead with the WHO Global Center for Traditional Medicine. Welcome, Dr. Bhushan, to this special broadcast as well. Dr. Shyama, I'll begin with you. You are somebody who's closely associated with the project and since the very inception, and you've been working on assimilating traditional knowledge systems from around the world for this center. What was your experience?
Thank you, Munmun. And as you said in your introduction, we're going back to our roots in a way, but also looking to the future, and it's been a very exciting journey. So we thought about assimilating knowledge in kind of three phases. So the first was looking at how we discussed with Professor Patwardhan as well, the practice-based evidence from homes, from communities, with the practice, with the communication, correspondence with nature. How has knowledge evolved and passed through generations? And then we had a second phase, which was the evidence-based practice, the science, looking at trials. But one of the challenges was, as you said, traditional medicine is holistic. And reducing it down to one specific intervention or molecule wasn't possible. And so we had to expand our ways of science and looking at traditional medicine knowledge. And now it's very exciting. We have new technologies like artificial intelligence, like magnetic resonance imaging that can show differences in brain activity when you're meditating. And this gives a bold, exciting new way to look at traditional knowledge and make its benefit available. So we're really excited on this journey, a knowledge journey from our past to the future.
So how was the seed sown for this project? How did the idea germinate?
So this was a leadership vision from the Honorable Prime Minister Narendra Modi and our WHO Director General, Dr. Tedros. And both of them saw this really as a way of connecting our past and our future. Traditional medicine is something that communities, individuals trust around the world. And even though it started as something very local in homes, it's now become a global phenomenon. You have yoga studios in every part of the world. You have people on apps. You have meditation, which is now needed even more than ever. And for many people, it's the first port of call for their healthcare and their well-being. And this is really PM Modi's and DG Tedros's vision of making healthcare available to all, but in a way that people trust and that is accessible and affordable to them. So we are very privileged to be translating that vision into practice now with the center.
Dr. Bhushan, Dr. Shyama looks very excited. Are you as excited about the project? And tell us about your personal experience with using traditional medicine, because you hail from Maharashtra, where traditional herbal remedies have been practiced, particularly in the tribal regions.
Yes, absolutely. Miss, we all are excited, in fact, because this is a wonderful opportunity for all of us. As a student of science, while I was growing, as you said, I'm from Maharashtra. I grew up in a joint family. We together were 24 people staying together, eating in one kitchen. So whenever something happens, there will be, everybody will be coming with some kind of advice. Even if you have common cold, there will be advice of something. And I was very curious that why this is happening. So when I went for science studies, I decided that I'll try to look at traditional medicine from science angle as well. And that journey was excellent and very exciting, and that is why my research, when all my colleagues were going in the enzymology, protein biology and all these genomics and these areas, I decided that I'll go to traditional medicine and look what is the science behind it.
So that's about your personal experience. How game-changing do you think this idea is going to be for integration of traditional ancient wisdom with modern science?
I think in today's world, it is even more important, because today's world is full of stress and other things. The power of mind, which is not really looked into so minutely in the current allopathic practice, I feel that the way traditional medicine looks at a person and not only at a disease, and holistic approach, which means body, mind and spirit all put together, this is a very, very powerful concept, because our body has its own capacity to heal, and traditional medicine is not just herbal medicine, traditional medicine is much more than that. It looks at you as a person and our own power to heal ourselves. Traditional medicine helps it to bring it up, So this is a whole journey which is very exciting from science point of view, and also for making it affordable for the universal health coverage, which is one of the most important focus of the UN.
How was Jamnagar in Gujarat, India zeroed in on for the WHO Global Center for Traditional Medicine?
The history in each state in India has been so rich for generations, centuries. And the Honorable Prime Minister had talked about Jamnagar as being the seat, and I'm sure Professor Patwardhan can add more, of traditional medicine knowledge, with one of the first research training institutions. But he also talked about, when he met DG Tedros, about this amazing story about how Jamnagar, during the World War, even before the United Nations formed, there were refugees from Europe before the World War, the World War started, who were on a ship, and a lot of them from Poland, and going around to different countries and weren't being taken in. And when they came by Gujarat, the royal family welcomed them and homed them for 9 years when they went back. And apparently the Polish parliament still thanks Jamnagar at the start of the parliament, and he was saying it embodied not only the rich tradition of traditional medicine, but also the spirit of the UN before the UN started in this global outreach. And the PM says Vasudhaiva Kutumbakam,
yes. Which is the world,
and this is embodied in Jamnagar. And Jamnagar also has this visionary approach to the future with industry and sustainable energy, and so it's a very vibrant place to be, not only for the history but for the future. So it's an excellent choice, and we are very proud to be there.
Do you agree with that? Also, I would want to know from you that since you are someone who's had a personal experience with traditional medicine, we are aware that as per current WHO data, around 40% of pharmaceutical products are based on natural products. Not many would know that aspirin is based on the bark of willow tree.
Yes.
So having said that, do you think that this center then opens a whole world of possibilities for integration between traditional medicine and modern science for holistic health?
Yeah, absolutely, because Jamnagar, as Dr. Shyama also mentioned, Jamnagar has been a seat of Ayurveda for a very long time, and India's first institute of national importance, has been established in Jamnagar. So obviously it was a good choice, and Jamnagar is also blessed with a very good biodiversity, a different kind of ecosystem, wherein aquatic ecosystem is also there, the traditional knowledge is there. So as you rightly pointed out, 40% of the current drugs what we see have some kind of origin, not only aspirin, but I would say even metformin, which is one of the most popular drug, or the anti-malarial drug, which has been coming out from Chinese traditional medicine, artemisinin. All these are very good examples. Today I must tell you, as a drug researcher, I am a student of finding new molecules from Ayurvedic medicinal plants or medicinal plants. I can tell you that these are the huge knowledge resources, and today drug discovery is actually facing innovation deficit, and we feel that the new molecules which will come from these sources will be much safer, will be much economical, and will be much effective as well. So as a source of knowledge, traditional medicine, we should not look only from the point of view of some medicinal plants, but they are the source of rich knowledge and rich materials which can be used further for the global health.
Absolutely. That brings me to my next question. Innovation and technology is a strategic area as far as the center is concerned. How will that be tapped? How will you bring together traditional wisdom from around the world, maybe using artificial intelligence, and also, make that accessible to the whole world through technology?
That's a very important question. Thanks, Munmun. If I could continue from what Professor Patwardhan just said, with this huge potential, actually the pharmaceutical industry has already noticed this and making it available globally. There are two aspects that are very important here. One is that this rich biodiversity knowledge as well, and resources, local knowledge, local resources cannot be exploited. So along with innovation and technology, sustainability and equity is a key focus of this new center. That the communities, the generations that have passed on this knowledge have to benefit from that knowledge and share that knowledge globally. So local resources and rights, including as regards intellectual property, is very, very important. And India has made great advances here in translating and making accessible written knowledge, so that for the intellectual property, the long history is established and cannot just be circumvented in that aspect. And innovation and technology will help with that. With digital libraries, the Prime Minister has especially requested a digital repository that would be a global good. And we are seeing with the artificial intelligence project that we've just started already for the center, the potential to map huge amounts of resource in much shorter time than we could through other methods, and the pharmacogenomics that Professor Patwardhan talked about. So it's really at the frontier of knowledge, and looking at how really in the spirit of the world as one family, we can respect local resources and rights, but at the same time make this a global good.
Dr. Bhushan, she made a very interesting point, and that is that it is important for local communities to benefit from the development of traditional medicine. After all, they've been nurturing traditional medicine and herbs for so long. How will the center make that possible?
See, basically this center will look at the traditional knowledge coming from all over the world. So it is very important that from wherever that knowledge is coming, the benefits are going back to the communities, which is typically sui generis system, which is practiced. In India, there have been some examples already that people have really taken some knowledge from communities and given them back. So this is extremely important, that we are not really using the traditional knowledge without giving something back to the society. Second, I will say that what we mean, modernity is evolving tradition. So, for example, Greek medicine, traditional medicine became modern medicine because it traveled with the modern science. So, I would say that it's a golden triangle. On one side of the triangle, there is a traditional knowledge. On the other side of the triangle, there is modern science, and third side is a modern medicine, and all three must work together, and that will evolve. So our center, what proposed center is talking about, is bringing the whole system together and bringing a model which is a model can bring in not only exciting science will emerge out of it, but it will benefit to the communities and people.
We've seen the challenge of an infodemic during the COVID-19 pandemic, and infodemic is something around which there is a lot of false and misleading information available in physical and digital environments. Amid such a challenge, we recognize the importance of getting the right information on various medicinal systems. How instrumental will the center be in ensuring that there is the right sort of knowledge sharing and such infodemics do not take shape?
Really important, and this is where WHO has a leadership role, because WHO is the world's leading technical agency on issues related to health. And actually 107 countries, member states of WHO, already have traditional medicine national offices, either as a ministry or within the Ministry of Health or with food and agriculture as part of the herbal medicine area. And their top request to WHO has been for standardized knowledge, for trusted knowledge that people can look to. And in fact, at the opening of this Innovation Summit, Prime Minister Modi had also talked about having a seal, a trusted seal on Ayush products.
Yes.
You know, that could give that give people the trust in saying this has been gone through a evidence-based process. You can trust this. It is safe, and that is our goal. So I think with commitments from countries for the country work and WHO's overall global leadership, that is one of our top commitments, is to make sure that there is safe, reliable information products for the optimal use of traditional medicine.
Well, the Prime Minister also said, Dr. Bhushan, is that there was a huge demand in India for traditional medicine during the COVID-19 pandemic. Ayush Kada, he mentioned, was extensively used. He also said that during the pandemic, the export of turmeric or haldi had increased many-fold, and shows the kind of demand that is there around the world for traditional medicine from India and from their parts of the world as well. How crucial will this center be in ensuring that pandemics can be combated, that there can be greater preventive health, promotive health to deal with pandemics now and in future?
Yeah, no, excellent question, Murmunji. I must tell you that pandemic gave us an opportunity also. And during this period of 2 years, Ministry of Ayush has done a fantastic work. You know, over 100 clinical trials. Many of them were very well controlled clinical trials, and prevention, adjuvant treatment and standalone treatment. All these three systematic studies have been conducted. About 25 papers already have been published, and we have shown that simple interventions, you know, like CADA, are very useful in prevention. And as you may know that in Delhi police, thousands of Delhi police were given this, and systematic study has been carried out wherein they have shown that definite protection has been achieved. We have done a controlled clinical trial, randomized controlled clinical trial comparing use of hydroxychloroquine against ashwagandha, head-to-head comparison. And in that trial we have shown that ashwagandha was able to prevent COVID-19 much better and in a much safer manner, as well as adjuvant. Ayush 64 was one of the medicine which was prepared for malaria treatment. We repurposed it, and again in randomized controlled clinical trial we have shown that use of Ayush 64 has reduced the hospitalization stay, and also general well-being of the patients was much better. So COVID-19 is just one example by which we have been able to give this kind of evidence, but I am sure in number of cases, you know, number of diseases, number of new challenges, traditional medicine knowledge will be important. I must tell you at the end, means why these kinds of epidemics or pandemics are coming, viral conditions are coming. Two important conditions we must. One is inflammation, and second is immunity. And both immunity and inflammation, allopathy has very limited role to play, as against traditional medicine has huge contribution towards both immunity and inflammation. And if you are able to target these two, you know, you will be able to not only improve wellness but also control and prevent several diseases, including infectious diseases.
Was pandemic the trigger for such a center, or was it a key imponderable for the same?
I think it was both. That I think especially now in coming out of the pandemic, as countries are recovering, renewing, there are a lot of lessons and opportunities from the pandemic to be learned, but also very, very important that countries need to mobilize all available resources to recover and renew and learn. And traditional medicine has huge untapped potential there, and it's something that communities own and trust, and I think it's untapped, and that's definitely, as you said, a catalyst for the center. I also wanted to stress one more point: the origins of traditional medicine come from a time, and not to romanticize it too much, but it comes from a time when there was better balance with our environment and nature, and nurturing nature and nature nurturing us, and learning from that, I think, is a very important moment now, not only in terms of the origins of pandemics and epidemics and viral transmission, but also in terms of how we get back to a better balance with the climate change and others. So many, many important lessons here.
Dr. Shyama, tell us more about the WHO strategy on traditional medicine and how India and the WHO are working together and also can work together in future to implement that, because in 1948 the WHO constitution came into force, and in 2022 we are looking at the groundbreaking ceremony of the WHO Global Center for Traditional Medicine in India, and soon WHO will be 75. India too is celebrating 75 years of independence. We've decided to celebrate and commemorate those occasions together. How can India and WHO work together?
India and WHO have been working together in this field for decades now. And even though the center has come up now, there've been extensive collaboration throughout these decades. So WHO also has a global traditional medicine strategy. The current one will be ending in 2023, and the center will help develop the new one moving forward. But every region of WHO, so WHO has 6 regions, and all countries within that are collaborating on national policies, on standards and regulation, on research, on collaborating centers. And so there's been an extensive collaboration network, especially with the Ministry of Ayush.
Yes.
And so and the center is just going to amplify the work that's already been doing. And Professor Patwardhan has been at the forefront of this collaboration, so he could give more examples.
Yeah, and right, Dr. Shyama, he was telling about collaboration. Jamnagar, why Jamnagar? I forgot to mention that Jamnagar also has WHO collaborating center for a long time already.
Yes.
So WHO collaboration with Jamnagar has been already happening. So that's right, you know, WHO and Government of India they have been working together. In fact, Dr. Shyama only told me while we were inaugurating at Jamnagar, just a day before that, one more collaborative center has come in Visakhapatnam, you know. So there is a very long and good interactive relationship with WHO, you know, and this will strengthen. GCTM is just one more step in this.
So there has been a lot of synergy, and this is going to go forward between WHO and India when it comes to traditional medicine particularly. Dr. Bhushan, I'm sure you'd appreciate the fact that there is a very nuanced approach when it comes to traditional medicine. We look at customized solutions for individuals in traditional medicine. We also see that certain herbs are more beneficial to people in certain parts of the country where they originate particularly than in other parts of the country. So will the center take forward this nuanced approach?
Absolutely, because general principle is whatever is grown in your area is beneficial for your communities, you know. So that's the general principle of traditional medicine, be it Ayurveda or any other medicine, you know. So that of course, and that also has bearing on the affordability, availability and all these factors, you know. But the nuances about personalization, what you talked about, is a very specialty of traditional medicine, I would say, because earlier also traditional medicine practitioners were treating you as a person. So if same person having different kind of symptoms, and traditional medicine will be designed for you based on what you require, based on your own constitution, which for example in Ayurveda is called as Prakriti, or in Korean medicine called as Sasang, you know. So this kind of a personalized medicine is a buzzword today. In evidence-based medicine also it is coming up. It is genomic based, you know, but that is going to be a longer way to go towards personalized medicine. We believe that if we take advantage of knowledge available in traditional medicine, we will be able to walk to personalized medicine dream faster and more effectively with less expenses, and also better chances of getting more holistic approach towards health.
Right. Are we also looking at in some ways employment generation, you know, via this approach?
Yes, we are, because yesterday Prime Minister also mentioned about it. If we are able to really connect farmers, because today farmers may be doing certain type of farming, if we give them more options, better options, wherein medicinal plant plantation, and the medicinal plant board in India is doing this kind of effort, direct contact with farmers and industries or users, you know, is going to immensely benefit to the agriculture sector. And that is what increasing income of the farmers, which is one of the main objective of Prime Minister and present government. I think Ayush sector or traditional medicine sector can help tremendously. And when India becomes one example and tested, many other countries can actually follow this, because farmers in many regions need this kind of a new change in their practices.
So from a broader perspective, will the center give a boost to sustainable development around the world? Will the way in which products are developed from traditional medicines be sustainable in nature? And do you expect the center to be a key step towards achieving the sustainable development goals related to environment and health particularly?
We very much hope so. And based on that link with the farmers that Professor Patwardhan just talked about, what is amazing is that Dr. Chi, who is leading our traditional medicine unit at WHO, had told me about how there needs to then be that link with traditional medicine practitioners who, for the medicinal properties of plants, know like, oh, it has to be harvested early morning to get the best effects, or which the farmers might not know. And you know, to have that kind of synergy. But also it's tempting sometimes to think about this as, you know, these local cottage industries, but actually these are trillion-dollar global industries right now. If you think about herbal medicines or yoga studios or health and wellness centers, really it's a trillion-dollar industry. And beauty products, all the natural products now that are coming out, mindfulness retreats, I don't know, just a huge amount of employment opportunities. But at the same time, the evidence base, going back to our first question, is really important, and the science behind it and the assurance of safety and quality of all of these products, and at the same time linking back to local communities and their resources and rights. So I think it's this whole circle that traditional medicine can help make these linkages to, and our past and our future, as well, as you started out saying. So I think it's a whole exciting new world that can make these linkages, and at the same time keep that framework of the sustainable development goals, which again are all interlinked.
Right.
So
before we let you go, wanted to know your views for the benefit of the viewers. If you could tell us that what were the gaps that you were seeing in usage of traditional medicine until now, and how the center is going to ameliorate that.
See, one of the major gap was making traditional medicine contemporary, bringing science in it, bringing evidence in support of what practices they are following. Getting evidence from practices as well, because as Dr. Shyama said, evidence cannot come only from laboratories. That is one part of evidence, but people are practicing. Practicing evidence also is important. So this center will look at the evidence from a fresh perspective and not blindly follow what is being done, because if you are able to create a new methodology which is epistemologically parallel to what traditional medicine concepts are, then you are making real justice. If you are blindly following some methodology just because it is available, you may not be able to get the right answers. So all this, the center will look at by creating entirely new approach to look at traditional medicine, which will be scientific, but at the same time based on the basic concepts of traditional medicine.
The one last question that I would want answers from both of you is that traditional medicine has been our heritage. Is it also our future?
absolutely, and I think science is the vehicle through which we are actually going to have this journey into our past but also into our future, and this center is an exciting new opportunity to do that.
Yeah, absolutely, it is future. I think future is integrative, so these silos which we have created, we'll have to forget about those silos. Ultimately people should be at the center. So what patient needs is more important than what my own discipline is bringing on table. So wherever it is available, so traditional medicine can, for example, give excellent non-pharmacological interventions. Modern medicine can give excellent pharmacological, surgical and other diagnostic intervention. We'll have to integrate everything together, and yes, in that traditional medicine will play a major role in future.
Thank you so much for such an insightful analysis, Dr. Shyama and Dr. Bhushan. It was such a pleasure to be doing this discussion with you here in Gandhinagar.
Thank you.
Likewise.
Namaskar,
Thank
Munmuni.
you.